Dr. Tripp sent a pinch hitter in. I should remind him. Wally Pipp was replaced one time on the field by the New York Yankees. He went out of the game and they put a guy named Lou Gehrig in, and Wally Pipp never got back into the lineup. So we want to remind Dr. Tripp that Jeremy Dalley is swinging for the fences today. Jeremy is a physician assistant at Tripp Family Medicine here in Twin Falls, and we're at 834. It's 45, and we're going to be talking a little bit about sleep and sleep issues today. And I was just sharing my sleep deprivation story with Jeremy a minute ago, and I'm sure a lot of people have these. If you have either kids or pets, or you see something on TV and you think, I'm just going to squeeze in a few more minutes. There's any number of things, Jeremy, we're talking about today.
Exactly. Those are things that are common, and sometimes those things are completely unavoidable. You can't decide how your kids are going to sleep or what your pets are going to do all night, but there are things that we can talk about today that you can modify. And there's a lot of people that deal with sleep issues. The statistics, according to a lot of studies that have been done in a specific American family physicians article that I was basing most of my topic off today, says that about 10% of patients deal with insomnia on a regular basis. And so that's a big statistic, as far as 1 in 10 Americans dealing with sleep issues on a daily basis.
There's sometimes I used to have a what do you call him, a Labradoodle years ago. It was my daughter's dog mainly, but the dog would come up sometimes, just put her nose on one of my hands when I was sleeping during the night, and that was a good signal for me that she had to go outside. I was much happier she did that than what could be the alternative. But still, you have these interruptions and the like, but sometimes these can actually help build some sort of sleep disorder over time, right?
Oh, definitely. Having interrupted sleep and having poor sleep latency, meaning, and we talked about this earlier before we started, if you can't fall asleep in 10 to 20 minutes lying in bed, then it's time to get up and do something that's going to fatigue you. That's a big strategy, and that's a lot of what I wanted to talk about today is sleep hygiene is really the way that we describe those particular habits that we can form in order to combat things like insomnia and poor sleep latency, which means we don't fall asleep as quick as we should, and so we end up staying up way later than we should or not getting quality sleep like we should.
Some of those old anthropologists claim that people used to sleep, what, 12, 13 hours a night in early days. And then, as we got more civilized and had street lamps and all of these other things and schedules and shift work, that we really messed up a good thing.
I think so. I mean, I think most of the issues that we deal with as people are because our lives are so out of order priority wise. We spend so much time working, very little time recreating, very little time sleeping. And work is that ultimate goal that we're spending our time on. And it's a tough thing because we're required to do it. But it does cause a lot of dysfunction, I think.
I know that in my case, what'll happen too sometimes is I'm watching a game and I'll think, well, I'll just watch it for a while and then go to bed at my normal time. And then the game gets exciting, and then it might go into overtime or extra innings. And so you say to yourself, I'm only going to do this one day this week, and I'll be able to take care of. But is that one day? I mean, is that bad for your health? Let's say if you do it once in a great while.
I wouldn't say so. I think most of the time, the things that cause dysfunction in our lives or they affect our health adversely are patterns. And that's sometimes difficult to discern. Is this an instance or is this a pattern? And the instances, they happen. You can't avoid kids waking up. You can't avoid your cat jumping on you at you know the early hours of the morning. You can't avoid those things. What you can avoid is patterns like staying in bed for too long or drinking caffeine or alcohol in the evenings, um, sleeping in way too long. Those things can be avoided, and there's a lot of strategies that we can talk about that can help to improve those.
I worked at a hotel in my early days out of college, and very nice resort hotel owned by a private family. Wasn't a big corporate place, but one of the co-owners, she had a son who was he helped run the restaurant, which was a big banquet facility. I would literally have to give him wake-up calls as part of my job every morning. And one day I said to one of my coworkers who'd been there a long time, does Jimmy have a problem with his sleep? And she said, no, he just doesn't know when to go to bed.
Completely different, right?
Yeah. In other words, he stayed up late to watch TV a lot and
Right.
then would have to get up in the morning at the same time. every day, and sometimes he was operating on just 3 or 4 hours sleep, I'm sure.
Sure. And I think the big question is, and a lot of people they ask me this. The reason that I bring this topic in today is I would say a great deal of my patients, probably close 10 to 15% of my patients, I'm talking to them on a daily basis about sleep and things that they can do to avoid insomnia or poor sleep quality. And the question that a lot of people ask is, well, is this adversely affecting my health? And the question is a big yes.
Hmm.
The recommendation is that most adults get between 7 and 9 hours of sleep a night. And that's based on a lot of studies as far as how can we reduce things like, fatigue during the day, how can we reduce poor poor quality sleep time, and even other comorbidities that we can talk about as far as health issues.
We've got more coming up with Jeremy Dalley in just a moment. He's a physician assistant from Trip Family Medicine here in Twin Falls. It's 8:40. Bill Colley with you as well. We're at 47. May not get a lot warmer today. We'll share that bad news a little later in the show. Details on that fact coming up. Jeremy Daly, our guest in studio, he's joining us from Trip Family Medicine here in Twin Falls. He's a physician assistant at Trip. And we do want to point out it's 47 right now. We're coming up on 8:42. Just a quick note to you as well. I've been telling you lately, if you're looking to plan for the future, you got to give my friends at Waddell and Reed here in Twin Falls a shout, because these people can actually help you out. Most of us have to think about these things, obviously, especially those of us who are getting a little bit long in the tooth, as they used to say. Waddell and Reed has been in business since 1937, one of the oldest firms offering mutual funds in the country. In fact, Waddell and Reed owns and manages two mutual fund families, investing by a conservative nature. And if you ask, do they know what they're doing? Of course, 80 years in business. And they'll take a planning approach and look at each piece of the puzzle for clients. Waddell and Reed helps build proper expectations and works with you on your individual needs and goals, building a plan around those. They'll help you manage money. And Waddell and Reed, they take planning personally. It's 8:43 now. We're coming up on 8:43, and Jeremy, we were talking during the break about the differences between sleep that people get. Some people are just fine. I referenced Jimmy Carter was legendary when he was president for getting by on 4 hours and said he never needed much more than that. I was told once by David Schumacher, who used to cover the White House for CBS, that Lyndon Johnson would sleep just a few hours a night, but every day at the same time, he would go back to the residence just after noon, put on his pajamas, turn off all the lights, and take a 20-minute nap in his bedroom. But the same time, every day, then he'd get up, get dressed again, go back downstairs to the Oval Office, and continue working. And he could work some incredibly long days, but he may only get 4 hours during the course of the night, but then that 20-minute nap seemed to revive him. We should point out he died of a heart attack not less than 5 years after leaving office, and maybe it had something to do with that. But there are some issues that play in there, obviously.
No, that's a great lead in, actually. Some of the things that we talk about as far as what happens if you're sleep deprived chronically, we see a really big decrease in people's immune systems. So infections tend to increase in those who get poor quality sleep, including pneumonia. That's a really common, that one has been studied actually, that people who have poor sleep quality over a long period of time actually can develop things like pneumonia more often. Now, other things that are really common as far as some really serious chronic issues, diabetes, cardiovascular disease, as you were mentioning um, earlier, cancer, and early death. All of those things are more common in those who sleep less or get less quality sleep for a long period of time. So it's a big deal. It's not just, oh, I'm just tired all the time and you know it's no fun getting no sleep, but you just have to get up and do things. No, it's something that needs to be addressed just like any other part of your health.
Now, when the doctor asked me a battery of questions some years ago, it was 4 or 5 years ago, and I ended up going off and spending a night at what's called a sleep center, and they monitored my sleep during the night. Then I got a prescription and ended up with a CPAP mask and the like. Um, and I was shocked at the time to find out just how many people we were talking after church one day, and it seemed like half my congregation was doing the same thing. Um, but there's going to be a series of questions you'd have to ask anybody, obviously, before you make a determination, and then you'd send them on to a specialist to really see what if you can pinpoint what might be the spot of trouble.
Yeah, that's true. That's true. If we're dealing with something that we suspect to be sleep apnea, then a lot of times then we're talking about doing things like polysomnography or a sleep study where we're looking at you know things like their oxygen levels while they're asleep, their muscle movement, their as far as their breathing goes, we look at their oxygenation level, we look at snoring, we look at um, all sorts of other different things, heart rate, and we're able to determine a lot of times are people having episodes where they're breathing less than they should, or do they even stop breathing, which is called apnea, and that's really common. Like you said, it's something that we see that's I think very underdiagnosed.
But people out there, when they come to you often, and you may ask them a lot of questions, but they'll tell you, "But I think I'm sleeping just fine, and I know I dream just fine," and they'll tell you all of these things. Then what? Even though it may appear that they've got an issue.
Well, we talk about it's a lot of it's based on history, Bill. I mean, if someone comes in, they say, I'm sleeping just fine, or I feel just fine. I don't have daytime fatigue. I don't have to take a nap in the afternoon. I, I always feel like I wake up rested. I don't wake up with headaches. If they're giving you that kind of history, you're not going to spend anyone's money doing a test. Whether it's the insurance company or that individual, we're not going to say, hey, let's just go do a test just because. We can't screen everyone for sleep apnea. It's all based on the history. So if you have people that come in who say, I'm tired every day, I go to bed at the same time, I get up at the same time, which is an important part of good sleep hygiene is you have a consistent sleep schedule saying, I go to bed at 9 o'clock every night and I wake up at 5 o'clock every morning. Whether it's the weekend, whether it's a holiday, you're waking up at the same time, and that's important. But if they're having symptoms, "Oh, I'm just so fatigued. I wake up and I feel unrested." Or, if there's other events, and you may know about this, maybe not. Some people say they gasp for air when they wake up. They'll wake up really quickly and then all of a sudden they're can't catch their breath and kind of this panic mode, and they catch their breath and a few minutes later they can lie down and go back to bed. But people who experience that, or they have someone witness them actually stopping from breathing at night, I mean, and that's called a witnessed apneic episode. That's concerning. Or people that snore all the time. Those are other signs that you could have sleep apnea.
Someone would have to identify that, though, because the sleeper doesn't know that they're snoring.
Yeah, you know, it's true. I would say for the most part, people don't, but there's some people who actually will wake themselves up snoring, and so we'll get that history quite a bit where they say, "Yeah, I snore so loud that I wake myself up."
Dry mouth would be indicative too.
Yeah, that could be having a dry mouth, or feeling like you have a lot of mucus production in the morning. Those are things that we a lot of times see.
Have you ever seen anyone come out of this? I mean, they go through a period, and maybe it's just a temporary thing that they're having sleep issues, and then but can that happen, or do they generally have to get some sort of attention?
That's a good question. When we're talking about things like insomnia, insomnia really is when people they have some sort of dysfunction as far as being able to fall asleep, get good quality of sleep, and it's affecting their daily life. Now, most people that experience insomnia, it's not permanent. It could be situational. Some people will experience insomnia because of a change in their life, having lost a loved one, or stress of moving, changing a new job. There's a lot of situational insomnia that happens, and a lot of times that's resolved once whatever underlying event that's been causing the issue, the stress, is overcome.
I read about some sleep history one time, or a history of people and how they used to sleep. That there was a time, maybe just a couple hundred years ago, where people would go to bed. They might sleep from 8 until midnight, but then they would wake up, and then they would be active for a time, 2 to 3 hours, even, then go back to sleep for another 4 hours, and then get up in the morning and still be refreshed. Is there any truth to something like that, that it could actually work?
Yeah, I think in total, if you're getting a good amount of sleep in a night, probably you feel well. Whether it's 4 hours interruption, another 4 hours, I would say you probably would feel rested. I don't know that that'd be really efficient unless there was something that you had to do at that time, and maybe there was something that they had to do with their occupation that required them to sleep that way or work that way.
Yeah, the guy used to have to ring the bells every hour. But people who actually, I think we all believe that we need an unbroken period.
Oh, I think that's without question. I think the nights when we have interrupted sleep, sometimes we could have slept the amount of time that we're typically sleeping, but even like 10-minute interruption two or three times during the night, 30 minutes of total interruption in your sleep can feel like you didn't sleep. And I've experienced that recently. I've been tracking my own sleep for the last probably 6 months. I have one of those watches that will tell you, when you're sleeping and your sleep quality and things like that. I don't know how accurate it really is, but it will show that I've slept really well some nights, and I'll feel like, oh man, I felt like I didn't sleep last night. It was just because kids were waking up at night sick, and there was something happening that woke me up in the middle of the night several times, and you feel like you didn't sleep, even though you did. So I think there's a lot to sleep.
Some people, it's obvious they're having apnea issues because they're falling asleep while driving or they're falling asleep at their desks. Um, I haven't had those issues in a long time, but I do know that there are people who have apnea issues that doesn't necessarily exhibit it in being tired in the middle of the day. That can happen too as well.
Sure. Yeah, it's not a one size fits all. You have to fit into this category to have sleep apnea. Certainly, if those things are happening, then I think it's prudent to be evaluated for sleep apnea. If you're having daytime sleepiness, if you're having, um, while you're driving, falling asleep while driving, that's an, not an uncommon thing. Scarily, that's not. We do a lot of these surveys where people say, "Oh yeah, I've done that before. Or I've done this before," and there's a lot of people that do struggle with that, but it's not always that way. I've had people diagnosed with severe sleep apnea, and it was based on the history of them snoring really loudly or witnessed apneic event during the night by a spouse or loved one, and there you go. They have severe sleep apnea, and they feel way better afterwards. But they'd been living with it for so long that their baseline idea of what they should feel like was altered.
Now, we've got a few minutes to go. I think that we wanted to point out too as well. You've got a couple of events at the office that we got to mention. One going on today, right?
Oh yes, we're very excited about this one. This is our peel party, our chemical peel party, and I'm pretty sure we filled all the spots that we needed to. We had 30 spots available, and we filled them all. And it's going to be an awesome event. There's snacks and I guess hors d'oeuvres, if you will, to prepare everyone to kind of enjoy this event. We're doing hand pills where they're getting chemical pills to the hands. We're doing consultations with each of these individuals and talking to them about their skin type and what we recommend as far as skin care for them. And then they'll get a chemical pill by our trained nurses, and and then basically some really good pre-care, post-care products and skincare products. And we're really excited about this event. And the thing about it is we're not doing this as a one-time type deal. We're doing this more as a kickoff to really initiate our emphasis on doing a lot of this, having cosmetic skincare available to people in the Magic Valley, and so we're really excited about it.
And again, for people who like to reach the office, how do they go about doing that?
Definitely give us a call. You'll talk to a person every time. Really nice people too. 933-4400 is our phone number. If you want to learn more about the office, you can find us at tripfamilymedicine.com or on Facebook. Recently, we initiated an Instagram account, so you can find us on there too. Any events that we're having or things that are going on in the office, you can follow us and like us and find out what's happening in the office. And that's probably the best way. Or just come in. We're located across from the post office on Fillmore at 1411 Fillmore, and we'd love to see you.
Got a couple of minutes to go, and I know there may be a couple of things too you wanted to mention as well about sleep before we wrapped up.
Yeah, definitely. So really, we've talked about kind of throughout the spot here today. We've talked about different things that people can do to help them sleep. A lot of times we're talking about medicine, and medicine is a temporary fix. Something that we use as a tool to help people reestablish healthy sleeping patterns. But the last thing that we want is dependence on these medications. And that's sometimes the issue that we're fighting is, trying to get people to make some changes in their sleep hygiene while we help them pharmacologically or medically to get good quality sleep. And and some of these, like we've mentioned throughout the show, it, it we talk about something called cognitive behavioral therapy, and we challenge the idea of what people think about what is good and what is not in terms of sleep, and this is used in um, other types of psychotherapy, and basically, it's saying things like, well, how how often are you sleeping the same amount of time? Are you preparing for bed in the same way? Do you drink caffeine after 3 p.m.? Do you drink alcohol in the evenings? Do you take naps in the afternoon? Are you exercising before you go to bed? Are you exercising during the day? Which is a big one. I would say people who come in, I almost always emphasize that. If you're not exercising on a daily basis and you're not sleeping, then you're probably not sleeping because you're not exercising. A lot of times that's the issue is people just their bodies are meant to be active, and we talked about this a little bit. Our culture is very much a sedentary culture where we're not moving. We work hard with our minds and with our fingers. Very rarely do we work hard with our bodies, and we don't fatigue them the way that we should. And so we're getting to the end of the day and we're not tired. We've been looking at computer screens and things like that all day, which is another part of this. But exercising on a regular basis can really help to improve sleep quality and sleep onset. Most of the time, if you're fatigued at the end of the day, you're going to fall asleep a lot quicker and sleep a lot better. The other thing that I really like to emphasize is the amount of time that we spend on our electronic devices, especially prior to going to bed. Those who spend time watching television in their rooms are not going to sleep well. If you have a TV in your room, take it out.
I learned that about a radio in the room too. Yeah.
Yeah, anything, even cell phones. Some studies have shown that having cell phones in the room can help you to sleep worse. So I think in summation, there are things that we can do that are not medicines that help even more. And we would love to talk to you about these things. So come and see us if you have any questions about your sleep, and we can talk and find some good solutions and answers for you.
I want to thank Jeremy Dalley for dropping in today, physician assistant from Trip Family Medicine. And I do want to point out as well, news from Fox is coming up at 9 o'clock. Also, writer, author now, and syndicated talk show host John Ransom will join us in a few minutes. He's written a new book, and it would be advice for younger Americans. Maybe advice they need, they don't always want to hear, but they definitely need it. That's on the way.